Welcome, everyone, to today's information session for the School of Professional Studies here at Brown University, specifically our Master's of Science in Healthcare Leadership program. Today is one of my favorite sessions where I get to talk with these wonderful alumni who have completed the program and are ready and willing and able to share their experiences that they had here at Brown and how they've used that education to further their careers. So I'm Sandi Ferretti. I have a similar type of degree, and I'm the program director for this degree program. And I'm going to be helping to facilitate with my colleague, Emma. I'm going to guide several questions, but after that point, we're going to open it up to all of you as participants to ask questions of our alumni directly. And we ask that you use the Q&A function in your menu bar on Zoom so that you can enter in your questions at any point in time. And when we get to that section of this meeting, we will use those as a reference point for the questions that you have. So I'm going to stop sharing so that you can all have a view of our alumni. So welcome to all of you. I am so excited to see you. And I want to give you a chance to introduce yourselves and tell us about what you're doing professionally now and how you think the MHL program has helped you so far. And you are all, I would point out that these are all recent grads and are enjoying their newfound freedom of being done with the program. So, Dave, why don't we start with you?
Sure. Thank you for having me, Sandi. So I'm David Munger. I'm a diagnostic and intervention radiologist, but my administrative role is the vice chair of clinical operations for Dartmouth Health for radiology. So I'm in charge of the operations for radiology across Dartmouth and their affiliates. I forget what your question was. It was something like, how's the program helped you, right? Something along those lines.
Yes. How's it helped you so far?
As Sandi knows, I was right before I started the program was actually when I got this vice chair role. So the program, I think, helped me guide my way to being an effective leader. I was essentially a staff radiologist prior to taking on this role. So it helped me in giving me the skills and techniques as far as people management, which is, I would say, 90% of my job as opposed to anything else. And then afterwards, my CCP, part of my charge when I took on this role was integrating across Dartmouth Health. We had a very siloed effect. And so my CCP was mainly focused on equipment purchases, but is kind of rolled into integrating across the network, our technologists and our staffing and our physicians to try and make us seem and act like a network. I shouldn't say seem, make us be a network as opposed to individual silos.
Yeah, that's excellent. That expanded the scope quite a bit. So that's excellent. Terrific.
Yeah.
All right. Kateri, I'll let you introduce yourself.
Hi, everyone. My name is Kateri Kelly. I go by KT as well. I am the Associate Director for Adolescent Medicine at Lurie Children's Hospital, and I'm a scholar and resident at Northwestern University, Feinberg School of Medicine. The scholars portion is fairly new after graduating from MHL, so that's one of the things. In my CCP, I looked at the early childhood effectiveness in adolescent and childhood early effectiveness disease or substance use rather disease in adolescence. And so through my CCP, I had the opportunity to share some of the early practices that could be done or implemented rather to decrease the long cost of care for adolescents and substance use. And as a result of that, was able to work with some of the centers throughout the university and the medical center and was able to establish the first scholar in residence program for population and community health. Specifically through Some of the things that were learned through MHL, very similar to Dave. The people management is a huge thing. Definitely when you're leading large teams of multiple people, multiple dynamics, whether it's clinicians or administrators or a hybrid of both in my circumstance, it's very important to know how to communicate to each person, determining exactly what they need and how to best serve the organizational scope. It's been an amazing ride. We were the first class to, or the cohort rather, to complete in 1 year. It is a very short time and a very long time at the same time. So there are going to be times when you feel like this is never going to end. This process is daunting, but the best part about this is that you create those bonds with your cohort members. And it's really important to lean up on that. There are going to be times when work is overwhelming and you may fall behind in your day-to-day work for school, and you need to lean on someone else to say, hey, okay, I need you to hold me accountable to make sure I get these things taken care of. Because if you don't have that accountability, it's very easy to fall through the cracks and not be able to get things done. So definitely establishing those relationships with the cohort has been most successful for me. And even after graduation, we've retained those bonds and have been able to communicate and even reach out to each other after the program because things still are happening. We're still leaders in healthcare and the landscape of healthcare, and especially those of us who are in academic medicine is changing day to day. So having a neutral party in another ear, someone you can trust outside of your organization to give you a sound counsel and someone who won't judge you is definitely something that has been most beneficial since then.
Great, thank you. All right, Azim.
Thank you, Sandy. So, hi everyone. My name is Azim Ahmad. I am a senior director for payer performance and network operations at Village MD. My CCP was a risk adjustment, looking at congestive heart failure through the utilization of artificial intelligence on unstructured data. So that's still in flight. So the idea there is just from a high level perspective is like being more proactive with our population that have congestive heart failure, and then also kind of bring down that cost trend that is always increasing year over year. My time at Brown was amazing. I miss it every single day. And these two individuals, specifically Dave and KT, were in part of my cohort. And as both of them have said, like it was an amazing experience of just learning. And it really provided me the holistic view of what a leadership role looks like. So as I have continued to climb in this ladder, it's also given me the opportunity to pick up on those skill sets that I didn't have before. And that holistic point of view, really specifically finance and cost accounting, is really coming into play here, the PMs that I'm dealing with. But just from a nurturing aspect of it, it was a community based, and just having the classmates that I did and just Brown in general, I think that was what propelled me to continue moving forward. So it was challenging, but it's been amazing. Was amazing ride, still is. So
So quickly tell me you have a new organization. So even though you just graduated, you have moved into a new role.
yeah, so obviously Brown carries quite the the weight. So I was in my previous role, I was in partnership performance at Centene Corporation, and so this opportunity came up around the time I was graduating, and this honestly, this degree really helped me be more confident in this new venture that I was about to take. And still murky, as in like from an enterprise perspective, but it's given me the abilities to kind of just navigate through like all the teams that we're working through with. So yeah.
Awesome. And that confidence to know that, yeah, I've got a strategy for you and we can do this and here's how I can help you. That's awesome. All right, so let's have you address time in the program. And I want you to think about what's a sort of memorable experience or a learning moment that happened for you, an activity or something that we did that really has stuck with you in terms of of keeping that and being a memorable moment for you, that learning moment. I'm going to start with Azim this time.
Oh, so there's many moments. I was aside from a lot of the snacking that I did with everybody else between the class breaks. Um, for me, honestly, it was I go back to this because finance and cost accounting class for me was I had never done that type of deep dive into it. So for me, that was an aha moment, and just that course allowed me to just look at the numbers very differently than I had been looking. And that was the aha moment for me. But like also just like bonding with my classmates during the in-person session, that was, honestly, I relived those days because they were really, really crucial in my development as I, went through the program. So
Excellent. KT, go in reverse order here.
One of my favorite, so I won't give out a lot of details because it's a part of the program. There is an exercise with a professor that we do as a large group that really hones into our communication styles. In this activity, we use a childhood favorite toy, and we are basically guiding each other, whether it be blinded, whether we're giving all the tools that we're supposed to be given, or whether we are just given items and told to complete the task. This was very simple, but it was very impactful on me specifically as a professional, because I use this as a tool now for my team. And some of the work that we do. And I've adapted it because it allows people who have multiple ways of learning to see it, to feel it, to hear it, and to actually experience, okay, what a breakdown in communication looks like. And when you're in a high stakes environment like a hospital or in a clinic, you don't have the time to have a meltdown. So you have to know how to readjust and figure it out rather quickly. And honestly, I refer back to that section of the course so often, especially right now where I am specifically in healthcare. Things are changing minute by minute. And so the protocols and procedures that we have used thus far may not necessarily be what we have to use for tomorrow. So I have to be adaptive in my learning and in my leadership as well. And so I would say definitely that class, in addition to what Azim said with finance, were honestly two of my favorite. And health law, yeah, I never knew I would need it so much, but I would say that definitely since that course, and over the last 6 months, I've become very good friends with the attorney in my hospital and general counsel. And so being able to understand the language and know the jargon and know that it depends is a full sentence has been has been great. But yeah, those have been some of the highlights of the program.
Well, thank you for not giving away the whole exercise there. But yes, that is a very memorable experience, and I think it's illustrates a lot of the hands-on activities and exercises and things that we have you all do to kind of really help bring it home for those points. So thank you for bringing that up. All right, David.
Well, I was going to use the one that KT used, but because I actually started doing that at my own institution with my leadership team as an exercise. But there is another one that is I won't give away a lot of details as well, but there's another one that is a computer simulated module that has a competitive nature to it because you're in groups, that is also very focused on communication and effectiveness of communication, as far as I'll say winning in quotes, but my group did win, so I'm gonna but that was the other one that I was remembering as a very distinct moment during it, just because it was both fun, but it had a very clear I don't want to say lesson because that sounds like I'm talking to children, but it had a clear focus that was very obvious both during, but even more so afterwards. And that I say it a lot in my leadership team here that communication is like 90% of our problems. Like we just don't communicate effectively or as well as we think we do. And that both of those modules really showed that to me. And I do think it's true. And I really enforce that we need to communicate openly and easily here. To KT's point about classes, I would also say that finance, which as a clinical operations, I lived in finance before this, but it helps me to communicate with the broader institution as far as the finances of the institution goes. I was very adept in understanding of radiology finances, which in general are positive margins. So I didn't have to deal with the other aspects of it, but it helped me to understand where financial people think money is going and how it's going and their understanding of support for services. In general, one of KT's and actually all of our partners, she's a care management person, and like her department never really brings in money in the sense of bringing money. And so it helped us to understand like, well, she's asking for this and how does this actually help? And how do those that are financially beneficial support the institutions? It really helped solidify that for me because I lived in a very narrow focus prior to that.
Interesting. Yeah, I think that role of systems thinking and how it all fits together and impacts everyone in the organization, that's really important learning points. And definitely, I think, I know for myself, those experiential activities really kind of bring the lesson home in terms of, and it's impactful and you remember it and you remember what that key teaching moment was. So thanks for sharing those things. One thing that prospective students ask me all the time is, how did you manage work and school at the same time? Because it's quite a commitment to be working full-time and trying to earn a master's degree as basically a full-time student. It's considered a full-time program and completing it in a year. So a bit more aggressive on our timeline of getting the program completed for all of you. So would love to hear kind of what your strategies were and how you found it to be in terms of managing both activities. I think KT spoke to it a little bit, so I'm going to let you talk first, KT.
Yeah, so planning is going to be everything. I lived, breathed, and died by my planner or the lack thereof of planning at sometimes. And I'm also made sure that I had my work calendar and my school calendar synced because I realized when they were not synced, things would be overlooked or I wouldn't, designate enough time in one area. So making sure that you plan everything, even planning date nights. Like I planned a day that I knew I had to go to the grocery store. I knew if I had neglected my partner too long, I needed to, plan dinner here. So literally put everything on my calendar. But also being very, again, communicative with your employer. Hopefully they are supportive of you in the completion of this. And so also it was important for me that if there were projects or programs that I was working on, that I had the opportunity to schedule those in a manner that would be successful for myself and the organization. And also getting their buy-in was the biggest thing to ensure my success. So when there were times where I knew I needed to put 3 and 4 hours into my CCP, I made sure that I was able to block some additional time during my day to get those things taken care of. And also there may have been larger tasks that needed to be done at work during that time that I just had to share the responsibility with someone else on my team and ask them, hey, I know this isn't, your job at this moment, but I really just need the support. So again, communicating what you need in a timely manner. And I think that was the most successful part. And again, just really relying on your cohort. You cannot do it on your own. If you try to, you will fail. It's very easy It's very easy to get lost in the sauce very quickly. We're all living life. Life is hard. Life comes at us a different way. And there was something every, quarter when someone had a life challenge and we just kind of came together and supported each other. So planning, communicating with your employer to get the buy-in, and also just really relying on your cohort members and making that chosen community and family to get through it.
Excellent. Dave, do you have any tips, tricks that you would like to add?
Well, I guess going off of KT, the other thing is making time for yourself in all of this, because otherwise you just get fully consumed. So my routine prior to the program was I would work out at 4 a.m. every morning, and it kind of got replaced by my academic and school time as a result. But about halfway through the program, I realized like, no, I need to actually be doing physical activity. Like it was affecting me mentally and physically. And going into this with a plan for what time you're going to give for your family, what time you're going to give for yourself, and what time you're going to give for the work and the school. It is manageable, but it has to be a conscious management. This is not something that you're going to just be able to adapt to. I shouldn't say that. You might be able to adapt, but you have to be a quick adapter. And then, as KT said, one of the things that kind of got lost in the sauce when I first started was making sure I was still there for family dinners and things like that, but special time with my wife and special time with my children, make sure that they weren't feeling neglected as a result of the program.
Mhm. But you were able to manage that, which
Yes,
is exciting. So.
Yeah, it is. And it worked out, and I think we were all excited for graduation day as a result, but it definitely and communicating with your family and your peers, as KT said, to like, this is what's going on. It's not that I'm ignoring you. I'm focused on schoolwork at the moment, and I will make sure that we have time on X time to spend time together. Really helped.
Right, exactly. All right, Azim, any thoughts to add there?
Just to piggyback on what Dave and KT said, I think it just goes back to just planning and having the appropriate buckets filled, like whether it's work, family, school. I think it's as long as you plan for it properly and just make sure that you're fulfilling each of those, I think you will be successful. I think it's just the biggest part is Brown is a really supportive community. The classmates are very supportive. The teachers and faculty are very supportive. The staff are. So that makes it easy. But I think once you get into the running into the whole work life and family life, I have a toddler. So that takes a lot of energy. So I think you just have to plan properly, have guardrails, just make sure that, you're not putting too much time in one versus the other. And then, I also had a lot of support at work. My people leader at the time understood what I was trying to accomplish. So they were very supportive. But again, going back to what KT said, you just got to plan, and then make sure that it's not going to be perfect, but as long as you're able to pivot, you'll be successful. So it's challenging, but it's very rewarding. So
how did you all feel about just the timeline in terms of knowing that this is intense for this period of time, but like I could do this for a year, and is that a realistic assessment? Like you can even though you're in the midst of it, you can sort of see the light at the end of the tunnel.
I would agree with that. I think at the beginning it's hard to see the light at the end of the tunnel just because you're overwhelmed, but particularly like all of us, actually all three of us, started with the summer cohort. So I think when we came back in the fall, like we were all adjusted at that point. We knew what we had to do and how we had to do it. We knew how much planning we had to put in. I was a good one for creating like an Excel spreadsheet with all the classes and when things were due and all that stuff, going through every course right at the beginning, so that way the entire semester was mapped out, and I shared it with everyone here. Because it just made your life easier. Like, okay, I know I have to put extra time to this week because there's a whole bunch of assignments due versus, the following week. And I think the other part that really helped was you never know what to expect for the first semester, but like the pre-work that you needed to do. It's a lot, and I think that really gives you a focus of like, okay, I am gonna have to buckle down before you're even on campus. which helps.
Yeah.
That's
Yeah.
my opinion.
Yeah, right. Figuring out how you're going to make time for that. Like, yes,
Mhm.
I'm going to need to make time
Yeah.
to do these things. That's awesome. Thank you. One more item I want to hit on that we were all chatting about before we got on with all of our guests is Azim raised some of the ongoing activities and things that are available to you as Brown alumni and particularly as professional masters alumni. But I'll just mention the career services that continue to be available to students. We use something called Brown Connect, and that allows you to directly connect with not only your students at the graduates that you have already connected with, but all of the alumni at Brown and all of the MHL alumni as well. So, but I want Azim to talk a little bit about what he is working on right now as an alum.
Oh, okay. So the network is very large, which is great to just meet new people that you haven't connected with wouldn't if you were on campus. So like as I was telling the group here, like yesterday I joined a multicultural leadership mentee group, and I'm based out of the United States, and everybody else was from far regions of Australia and Japan, and as well as Middle East. So the network is amazing, and one of the opportunities that I've had to been fortunate to do is like work with a previous alumni working on the startup idea that they had through their critical challenge project. So the opportunity through this MHL program allows you to intersect with so many diverse people, and as well as like ideas. And then like Sandy was very gracious enough to be like, hey Azim, maybe you could connect with yeah. So I think it affords you a lot of opportunity to meet new people, understand a lot of just different projects that are going on, and maybe you could be a part of the solution moving forward. So it's a great opportunity even after you graduate. So
Absolutely. And Brown does in most major metropolitan markets in the United States as well as some overseas. There are Brown alumni clubs that do various different activities and social networking and things like that. So there's definitely very active ways to stay engaged with the Brown community. So it's just exciting. So with that, I would like to pivot, and I know, Dave, you may have to drop off, and well, thank you so much for joining and providing your insight. So Emma, if there's any questions that you think are mostly directed towards Dave as a physician, please do those first.
So I am taking a look at our Q&A now. And I don't think that we have any questions like that. However, we do have a couple that came in, and two that were submitted before the session. So I'll start with the ones that came in. This first one is, in what ways would this program provide me more insight into CMMS slash HHS programming and US for nonprofit health systems?
For a nonprofit, yeah, for profit and not for profit.
I could touch on that a little bit. So that was my world for probably about 10 years, working in global health and at an international level. And I see that you're also unemployed right now. We had several classmates who had a very similar timeline when they started the program. I think the biggest thing when coming up with your CCP idea is not looking at your current circumstance, but where you actually want to be, right? So your current employment may not be, you may not currently be employed, but what are you seeking to do with your next employment opportunity? Are you coming to Brown to grow your network and to go into a new market, or are you seeking opportunity to expand in the global health or US health-based systems. There's a lot of ways to look at that. And honestly, I think the easiest way to start looking at a way or looking at a topic for your CCP is look at what you're passionate about. So if you're passionate about, let's say, water toxicology, just something off the top of my head, right? Don't look at it from the perspective of what you've done in the past, but look at a way to solve a problem that you knew existed and you didn't have the funding to do it. So if you had all of the money in the world, all of the resources, what would you do to solve that problem? And I think that's the easiest way for you to start. Ultimately, everyone's CCP changes in some way. Sandy will tell you that over and over again. We will come in and say, oh no, this is exactly what we're doing. And then December hits and we're like, actually, this is not what it's going to be. So don't feel like you are going to need to know everything now. As long as you have a nice outline, a skeleton of what you're interested in, you can fill in the blanks. And most likely what will happen because of the knowledge gained through the program, you'll get more information about other things that you may not have ever been exposed to, and then that will allow you to develop your CCP over time.
Excellent.
So it looks like our next question in here is, will the curriculum cover key areas such as population health, value-based care, accountable care, patient safety and quality, and an introduction to quality improvement methods, given that the future of healthcare is increasingly centered around these models?
I can take that one. So yes, at a high level, there's many of the modules and the specifically classes go through that. I mentioned one of them was finance and cost accounting. I mean, we really have focused on value-based care and just the modeling, and then you go through so many exercises just in that class. But there's like the policy class that can kind of guide you in that, and the faculty are so knowledgeable in each of these mediums that it's going to cover the whole gamut that you're asking and more. And then the idea there is like, the more you understand and the more questions you'll have, and then there's more answers forthcoming from the faculty and staff regarding that. So it is a very much a holistic approach. It's looking at the present and also where we're moving to the future in healthcare. So I would say 100% everything will be covered there.
Yeah, and to piggyback, you definitely get a lot of information also on quality. HRO, you're going to hear that over and over again. High reliability organizations. You are going to hear it until you are blue in the face, but it's important because it's the way in which healthcare is successful. And especially right now, there are a lot of organizations who are not HROs, right? So it's making sure that we are setting the standard and understanding, similar to if you all are football follow football. One of the coaches says the standard is the standard, right? And so Brown teaches us that the standard for healthcare is the standard and there's nothing else around it. So it's important to follow the standard, regardless of what other outside externalities may be. The standard is the standard, and Brown is going to teach you the standard, and it's going to also teach you how to think as a leader and how to be a problem solver. So if that's what you're looking for, this is the place to be.
Thank
Excellent.
you. So
All right.
one of our questions that was submitted prior to the session, with this degree, what type of roles or positions does it qualify you for? And what kinds of jobs have the alumni obtained after completing the program?
So I guess we are kind of all over. Zim can tap in, and so I work in academic medicine. By training, I am a bench scientist, but I left the bench and went into global health, and from global health went into academic medicine. So again, that I'm someone who bounced around the paradigm of healthcare. Then you also have individuals like Dave, who was just on the call, who is a clinician, who's a physician, who also is now an administrator. We have people who work in NGOs. We have people who have backgrounds in the military. And so for them, that was an entirely different situation, because you had some people who had no formal healthcare experience, but they were interested in learning more. But they had applicable skills that were translatable, right? So it's not that you have to have one specific background, it's what you're interested in and how you would like to move your career forward in the healthcare field. And then we have Azim, who is in tech and moving things ahead in
Uh,
healthcare.
yeah, just to like, I think KT, you made a great point. I think before I joined the program, I very much was in like the MCO type of focus. And then when I met my cohort, it was just like a mind-blowing experience of like so many diverse views of healthcare were coming to the table. And just learning from that is, I think, is so beneficial because it gives you, I think I mentioned, is the holistic lens of what that means. And then that way you can incorporate that to what you're doing in the present as well as the future. And then from a career standpoint, like it allows you to pivot. It kind of opens up more gateways for you in a lack of a better word. It's because it's just like you get to see opportunities in healthcare where you potentially may not have looked. And then also like this specific degree is really good for like if you are really wanting to become a healthcare leader, or you are wanting to continue to grow in that sphere, because you get to see the approach from every single angle of what a good healthcare leadership quality looks like. And then you can kind of marinate and make that into your own formula. So it's not like just a standard approach in the, not to say that's bad, but it more like it's like, you could customize it to what you need. And I think that kind of really helps. Just like the experiences you're going to experience at Brown, and then how that marries to your work, and then what you want to do in the future. So like you get a lot of ideas and opportunities.
Yeah, those are terrific answers. And we'd like to also encourage people, if you're interested in learning more about what alumni have done with in their careers post MHL, we do have a specific session on return on investment that really walks through a whole number of case examples of what folks are doing, the ones who have pivoted, the ones who've continued to grow in their leadership, the ones who have started businesses. We really have some great examples of what alumni have accomplished.
So I'll go ahead and I will drop the link to the YouTube recording from our last return on investment session into the chat for anybody that's interested. And then another question that we just got in is, can you speak more about how the program touches on the use of AI in health and prepares the students for those changes?
Yes, that's for me. So surprisingly, it's you are able to connect with so many faculty and staff regarding artificial intelligence, because my CCP is around that regarding risk adjustment. So you're able to see, and I'm sure like more classes are forthcoming as we're kind of like evolving with AI. You get to see through the class courses like where AI can be a benefit. And then also you get to do, like, if you want to like further do your own research in capabilities versus what are the problems and how you could potentially use that to come up with a solution. So AI is everywhere, but like I think you have to just like with the class courses and the curriculum, like you can apply to what you're wanting to do. And maybe Sandy, I know I haven't looked at the curriculum for this for coming this year, but like maybe you could speak more on that as well too. So.
Sure. We have, there are some dedicated modules in our sort of technology-based courses with faculty who are, experienced and bring examples to the table. So I think that's a really helpful component. But I think what you raised, Azim, is really important, that faculty are increasingly incorporating sort of how does AI impact this or that particular topic that they're talking about in the context of their particular academic field that they're talking about, whether it's quality improvement, whether it's law, the impact and role of AI, the ethics around it, the leadership requirements, all of those types of things get addressed as you're going through the program. And increasingly, those questions around AI and the role that it can and will play, maybe eventually, is certainly topic of conversation.
Thank you. I'm just going to give a last notice for anybody to drop their questions into the Q&A. And while we wait to see if any more come in, there was one more that was submitted prior to the session. What did it mean to you to have a mixed method structure in regards to having some classes in person with most online?
I really enjoyed it because it allowed us to, one, gain the community that we needed in our cohort, but also was not long enough where, one, it became burdensome to our day-to-day life at work. So if I needed to be in person for a longer amount of time, I could see where it may have become a conflict with my job, with whether it be taking time off, but also just being away from the work and my responsibility as a leader. But being able to take, 7 to 10 days away from the office was perfect. Like, again, it was communicated. This is what I need. Sometimes I flew in 2 days before. Sometimes I flew in 12 hours before I needed to get there. It just really depended upon what was happening at work. But once we were there, we were able to, again, have those dialogues and communications with the professors and the staff, as well as my cohort, to make sure that we understood the work. And it's helpful to have that exchange of knowledge before you actually get into the bulk of the work, because, again, then you have someone you can rely on and to be of support of you when you are working through it. And then there are also going to be a lot of group assignments, and so it's easier to work in a group with someone you already have a dynamic with. So to me, it was perfect, and allowed me to, again, get the best of both worlds in the experience.
I will echo what KT said. I think the idea of going in person before, as the program's starting, building that relationship with your classmates, with the faculty and staff, I think is so critical. And I think that's why the program works so well, because like you're there in person, you're dedicated to what's going on for that week. And then you're also building, forming friendships and relationships. And then when you get home, it's asynchronous, but like you know everybody. So it's easier to break that barrier and just work like a team. And that worked really well. So like everyone understood what that meant. And then there was no like, it's virtual world now, but like that person really session kind of really sets the tone for the entire year. And I think that's really crucial. I really appreciate how the program is built out that way. Selfishly, I wanted to go back to Brown for another week, but like, maybe next time. So
Hey, a commencement weekend is always alumni reunion weekend.
Yeah.
So, you'll get a chance to come back for all the good stuff. Yeah, I think those are really great points. You all can't say it as well as I do, and that's why we structure the program the way that we do. I really feel like when I peek in on your online discussion forums and things like that, they're real genuine conversations and meaningful contributions. And I think that's in part because you have established relationships and you're able to, speak freely. And because I know I'm talking to KT and I've met KT and I've worked with her and et cetera. So it's that's really, I think with the hybrids, you get the best of both worlds and you can continue to work full time, which is important to so many folks who are trying to advance their careers. Not a time when you can take a year or two out of your work life to dedicate just to being in school. It's really hard. So we get that, and we've tried to structure the program around that. So, any other last minute questions that came in?
It looks like that was our last one.
Great. All right. Well, I want to say thank you to Dave and to KT and Azim for joining us today. And as always, please be free to reach out to us here at Brown to to make sure you can get all of your questions answered about the program, about how it works. If there are specific areas of healthcare that you would like to be connected with an alum, I often do that with prospective students. So please feel free to reach out and we will get you connected. Thanks, Emma, for putting that professional@brown.edu email address in the chat. So feel free to continue to reach out to us. Our next session, I believe, is an alumni chat with folks who are also veterans. So we will focus a little bit more on the veteran experience with our alumni and look forward to that session. So feel free to join us for that as well. Thank you, everybody, for joining today and have a great day.